Welcome, and thank you for tuning into Northwark General's House Calls, a community conversation. Before we get started, I wanted to cover a few housekeeping remarks, pun intended, and please remember to mute all your lines as well as submit any questions and comments through the chat. We'll do our best to get started. We'll do our best to answer as many questions as possible. I'm Nicole German, the Global Head of and Vice President of Digital Marketing, Sales and Growth for Scotiabank, and Chair of Northwark General Foundation Board. And I'm excited to be here and have the privilege to introduce our panelists. A warm welcome to Dr. Joshua Tepper, President and CEO of Northwark General Hospital, who is also a practicing family doctor as well as a well sought after thought leader on healthcare policy and patient care. Welcome, Dr. Tepper.
It's a pleasure to, can you hear me okay?
Yes, we can.
Great. All right, I apologize for that. You would think this many months into the pandemic, I would have figured out the mute and unmute. But it's always learning. And again, it's wonderful to join you tonight for another evening. And I'd like to thank the foundation for having organized this important educational event. And to thank Nicole for starting us off and for hosting tonight and for being our new chair at our wonderful foundation. Since we've chatted at our last house call, there's been some really good progress in the province of Ontario and the city of Toronto. We have seen a steady decrease in the number of patients who are hospitalized with COVID-19. We have seen a decrease in the number of patients in the ICU within our hospitals. And we've started to see a return to some of our surgical and other clinical volumes, which is wonderful. Certainly not back to where we were, but on a path and with a clear coordinated plan for the province. More broadly, we've seen our numbers outside of the hospital improve as well. I think in Toronto today, in Ontario today, we had about 161 new patients identified, and we've been under 200 for most of the last week or week and a bit, not consistently, but for most of the last week and a bit, we've seen less than 200 cases, and we've even been down into this 160 range for a little while. And here in the city of Toronto, where most of us are today, or I guess yesterday now, we saw 58 new cases, which contributed to that 160 number. And 58 again is I don't think we've seen a number that low for at least since early mid-March. And so this is really great progress. And I thank everybody who's been wearing their masks, who's been physically distancing, who's been quarantining and isolating themselves when they've been unwell or been in touch with somebody who's unwell. And so I think collectively we've really started to bend the curve of this, which has allowed us to open up society carefully and cautiously into phase 2, which is a wonderful place for us to be. So overall, the numbers are much improved from just a few weeks ago when we last gathered for a house call. And I think the key thing to remember is to continue the good things we're doing that have brought those numbers down. Because as we've seen in other places in the world, even just south of the border, it's very easy for the numbers to come back up. So we're in a good spot because of that hard work, and let's continue the hard work we've done.
That's great, Dr. Tepper, and I know there's lots of questions about that, and so we'll get a chance to talk through some of what's to come in the next little bit. But before we do that, I'd like to welcome also Andrew Yu, Vice President, Portfolio Manager, and Director of Research at Burgundy Asset Management, and Northwark General's Foundation's Vice Chair of the Board and Investment Committee, who tonight is going to share a bit of an insider's perspective from his standpoint. Really, none of us could have predicted the extent of COVID-19, these termed near events in both the healthcare and the economy. So we look forward to a very candid discussion from a financial perspective, but also the healthcare perspective. So thank you, Andrew, for being here today with us this evening.
Thank you. I'm very excited to be here.
I guess, Dr. Tepper, maybe I can, you gave us a little bit of an opening. I wanted to see if you could just maybe elaborate a little bit. You talked a little bit about where we are today, but how about anyone seeking emergency services? Should they feel safe about coming to the hospital?
Yeah, that's a great question. And I think we have been worried actually here in the hospital system about how dramatically our emergency volumes dropped, particularly for things that we know happen, strokes and heart attacks. And so the answer is yes, the hospitals are safe. We encourage people to come in and seek care. When you come in, we ask you to respect the rules that we've all set in place around limiting visitor access, wearing a mask, hand hygiene. So yes, we want you to be safe and keep other people safe when you're here, but it is absolutely, we need you to come and see us when you need medical care.
That's great. Now, Andrew, can we turn it over to you maybe just for some opening remarks from the financial or economy perspective? And, you know, while obviously a different space, a lot of people are thinking, you know, often about what's happening from an economic standpoint, both from a professional standpoint, but also a personal standpoint.
Yeah, definitely. I can kind of recap what's happened in the markets since the virus unfolded. You know, it was very interesting. In January and February, the global equity market was rising, and it was rising in spite of the outbreak happening in Wuhan. So it kind of looks very silly in retrospect now that, you know, markets were sort of rallying as this virus was making its roots. That all turned around March, and there was, in late February, and we saw quite a precipitous decline. In about 33 days, the market went from its peak to its trough, which is a record, close to a record time in terms of a bear market. In the market that I cover specifically at Burgundy, which is Canadian small caps, we saw the market go down 46% in those 33 days. So pretty staggering declines to have, you know, about half of the market capitalization of small companies in Canada wiped out in about a month. From the market bottom in March, we saw a very strong response from governments and monetary authorities. So central banks around the world intervened to support bond markets, to liquefy bank balance sheets. We saw fiscal authorities step forward, provide wage subsidies and many other programs to kind of put the economy on life support and to ignite the economy through the quarantine. And since that time, it's been a very strong recovery. The equity market now, if you look at most large cap markets around the world, is pretty close to where it was at the start of the year. There are some areas and pockets which are still down, smaller companies, some emerging markets, but for the most part, we've seen a big recovery. The pattern very recently has been to trade on, see pretty significant downdrafts that have been short and temporary on case spike ups. And so, you know, Dr. Tepper was just mentioning south of the border. You know, today the market was down almost 3%, and that was largely on spike up information in Arizona and Florida and Texas. So I think that's what we're seeing now is we're seeing information around case count going up in certain places, resulting in short market downdrafts. But over the last little while, at least, those downdrafts have been followed by pretty quick recoveries.
That's great. Thanks. A great way to sort of kick off this evening with a bit of an overview. I wanted to ask you, actually, both of you a question, how you both are really preparing yourself mentally as well as financially now and in the future, and particularly what you're thinking about if there is a wave 2, in fact. And maybe Dr. Tepper, could I start with you?
Sure. I think I'm going to leave the financial preparation to Andrew, and then I plan on taking a lot of notes when he speaks. In terms of the mental preparation, you know, I think it is hard. We're dealing with a tremendous amount of uncertainty, and that uncertainty it's hard. It's hard to live with uncertainty. We like, for the most part, most of us, to know what's going to happen. And there is a lot of uncertainty: schools, camps, work, employment, the economy. And then, of course, the surge and what will happen if we get a second wave in the fall, and what's the flu season going to look like with this. So there is a lot of uncertainty. And I think it is important that people sort of maintain strong social networks, physically distant, but strong social networks, that when they have mental health concerns, they seek out professional help. And that we're just very honest about where we're feeling, because if you're not having some anxiety and some sort of emotional response to what we're all going through and what lies ahead of us, I'd be surprised. So acknowledge how you're feeling, and surround yourself with the supports you need, and look after yourself as well. Exercise, eating well, regular sleep, minimizing alcohol, all really important parts of maintaining our well-being.
I think that's great. I always think about, the first step is really that self-awareness, is really kind of, sensing that, I don't have those energy levels or feeling off, I think. But to your point, I think those are some really great, ways to think about it and recognize that a lot of people are feeling very similar, right, in those situations. So. Andrew, do you want to comment? I think, we know he left the finances to you, so we'll let you touch on that, but also, any other perspectives you have to share would be great.
Yeah, I think if there is a second wave, we're going to see a big bout of volatility in the markets. And I think to prepare for that, I think you want to do two things. One of those things is to be well researched. For what I do, I cover stocks and in Canada. And really what I'm trying to do is know a handful of companies really well. And so when there's volatility, I can act and I can invest in those really good businesses that are set up to succeed and be resilient. And I think that same approach applies to personal investments as well. I think when there's a moment of market volatility, you sometimes get great opportunities to invest. And if you're well researched, you know exactly what investments you might want to make during that time of volatility. You can lay the seeds, so to speak, for good future returns. I would echo a number of the things that Dr. Tepper said as well. I think it's very easy to feel anxiety and fear around the stock market. In March, every headline, every news article, every television show was talking about how this is going to be, a terrible depression. The data since then has actually been, I think, surprisingly good. But in that moment, you feel a lot of fear. And I think that you want to mentally prepare yourself for that feeling again, and to sort of remember that although there's a lot of negative publicity around the markets and the economy, sometimes the best opportunities are actually when markets are down and are volatile, and you can make good investments. So I would just leave it at those two things.
Great. That's fantastic. So we've got lots of questions. We've had some that have been submitted in advance of this evening, some that are coming in real time. And so I'll get started with a few of them, and we can go from there. But Dr. Tepper, as you mentioned in our first house calls, anyone can get tested right now. How are people in hospitals, long-term care, and other essential service roles being tested?
So that's a great question. Again, just to repeat what you said, anybody right now who wishes to get tested can get tested. People with symptoms as well, coughs, runny nose, fevers, diarrhea should absolutely consider getting tested and seek testing. And those who've been in contact should get tested as well. And our capacity in our province has gone up a lot. We were doing, a few thousand and up to 10, 12, and now we're north of 20,000 a day on average. So that's a really significant increase in capacity. The second issue is around hospitals and long-term care. We screen people when they come in every day to our hospitals. And if they have symptoms, if they've been traveling, if they've been in touch, then they absolutely get tested. And so again, we have occupational health and other systems in place for screening and directing people to testing. In long-term care, a series of guidelines have been put out, both to cover residents, the staff, and now visitors who are coming in, and what the testing protocols are for them. And so those may change over time, but right now we are testing on a sort of regular basis those people who work in long-term care homes, as well as those who wish to visit long-term care homes as well. And then again, if there is an outbreak or if there are symptoms, then the testing again gets enhanced and will be tested specific to what's happening there.
That's great. So just to continue along the conversation around long-term care specifically, Dr. Tepper, what has been Northrop General's roles specifically with long-term care facilities? And also, how do you see that evolving in the future, just given all that we've learned over the last number of months?
So what people may not realize, because they think of us as a hospital, is that we actually also own and operate a 200-bed long-term care home just across the street from us on Leslie. And that's called Seniors Health Center. So we've been in the long-term care business for a long time. And so we have a lot of knowledge. And very early on, we took a lot of steps to make sure that the residents and the people who live in and work in our long-term care home were well protected. We also then have been supporting and working in collaboration with a large number of retirement homes and long-term care homes, homeless shelters that are in the North York region. And so we've built partnerships to be able to help them with infection prevention and control and cleaning and education, sometimes providing personal protective equipment, providing specialist and medical backup. And so there's been a range of things that we've worked collaboratively with people in our community up here in North York. And I think we're really proud of the partnerships and the good effect and the good benefit that it's had.
That's great. Really wonderful. Andrew, I'm going to over to you. You talked a lot about the markets, but what do you foresee, or what's the thinking about just the general economic outlook, in general, but then specifically how that can impact institutions or organizations like the hospital, North York General Hospital specifically?
Yeah, I mean, I guess I can talk about the markets and the economy and how it's impacted the foundation and maybe the foundation's assets. Myself and my colleagues on the investment committee, we look after the foundation's assets, and the vast majority of those assets are invested in one investment manager. It's a global equity firm. They are concentrated on quality companies. And so they tend to avoid businesses that are highly cyclical, have lots of leverage, et cetera. And because of that tendency, they have done very well through this environment. They've largely avoided the blowups, things like oil and gas, things like travel, et cetera, which have been big drags on the stock market. And so I think we feel pretty good. I mean, I think there's going to be volatility. Certainly if there's a second wave, there will be more. But I think we're very happy with how that manager's done. I mean, they're actually up for the year now, which is, I think, quite a feat. And we feel very comfortable with how those investments are positioned.
No, that's great. So I'm just going to shift in some of the other questions that we've got coming in here. This is an interesting question for, essentially it's asking about, as places open up moving into stage 2, what about people that are over the age of 70? How should they be thinking about, as things open up, interacting with others, going back to a normal course of the day-to-day? Maybe you could offer some thoughts there, Dr. Tepper.
Yeah, unfortunately, one of the things we've learned early about this virus is that that older people are preferentially impacted. Not necessarily that they get sick more often, but when they do get sick, that they're more likely to become extremely sick and ultimately have a much higher risk of death than people who are younger. And so I do think, although we're opening up, people who are older or people who have underlying other health issues, which makes them at a higher risk of getting very sick or dying, need to be more cautious. And so I would encourage people who are at risk because of age or because of other health conditions to be extra careful. The more you can have people help to limit your need to be very engaged in, tight areas like grocery shopping, et cetera, try to get help, try to do things that will maintain your physical distancing. You're just gonna have to be extra attentive to maintaining physical distancing and minimizing close physical contact.
Great. I think those are some great guidelines. And a lot of, I know I hear this often, a lot of curiosity, and we hear, different pieces here and there, but anything that you can share with respect to an update around a vaccine or a treatment, I guess, for COVID-19 specifically?
So it's important, there are actually two questions, and they're both really good questions, Nicole, but to separate out treatment from vaccines. So a vaccine helps us get sick or prevents us from getting sick in the first place. And there has been remarkable progress being made, several trials occurring at different places around the world, and almost at an unprecedented speed, I would say. But that doesn't mean we're there yet. And I think even the most optimistic people are thinking about sort of end of this year, early next year. And there'll still be a lot of questions. You know, do we need different doses for different age groups? Will this be a vaccine that is permanent, or will it need to change every year as the virus mutates? Will it need a booster periodically? So there's still uncertainty. Can we get a vaccine? Although there's some optimism in place. And if we do get a vaccine, how can we distribute it? Do we focus on certain groups like older people first? And there'll be other questions again about the future of that vaccine, how long it lasts, et cetera. So that's vaccine, that's preventing you, that's receiving an injection, a vaccine to keep you from getting sick. Treatment is a different issue. That's if you do get sick, what are the options available? And again, that's a very active area of science and study and research. Unfortunately, for the most part, there's not been a lot of success yet. There's some very good clinical trials underway, looking at medications, combinations of medications, and also looking at more intensive things for people who are extremely sick, plasma treatments, certain type of intensive care things called ECMO, extracorporeal mechanical operations. So for very, very sick people. So there's a lot of different studies about treatment going on right now. But the reality is that there is no proven treatment right now. Everything is still in a research stage. And the research is really focused on people who are very, very unwell for the most part, very, very sick in hospital, often on ventilators. So that we don't currently have a treatment for people who are more mildly sick. And the research, like I said, is focused on those who are very, very ill.
That's great, thank you. So Andrew, let's shift over to you. We've been talking about, again, the economy. You know, what are your thoughts around suggestions, you know, for thinking about the restoring of the economy and really what we should be looking towards there?
Yeah, well, I think that economic recovery is really dependent upon confidence. You know, you need to have the consumer feel confident to go out and spend again. You need businesses to feel confident to go out and invest again. And so, you know, what I think is really missing and what is really needed is some confidence. And I think, you know, one thing that would be really helpful, and obviously I think, you know, it's a much harder thing to answer. It is a difficult thing to answer, is if there is a second wave, what will the quarantine measures look like? And what can we do to keep the economy at least partially reopened? You know, I think that part of the reason there is not a lot of business confidence or personal confidence is because people look at the first quarantine and some of the economic data that came from April. And, you know, it's pretty astounding. Hotels running at 5% occupancy rates, retail sales down 35%. I mean, very, very scary looking numbers. And I think part of the reason we don't have that confidence yet is because people fear that if there's a second wave, you know, the economic data is going to look a lot like what it looked like in April. So anything the healthcare authorities can do and the governments can do to say, if there is a second wave, this is the protocol for what the quarantine will look like. And these are the measures that we have in place to keep the economy partially reopened so that we don't have a similar sort of numbers that are similarly bad as what they were in April.
Yeah, great. And then from an individual level, there's a good question here. You know, is it a good time to make a big purchase, i.e. a home? You know, how should people be thinking about that?
Yeah, well, I'm not a real estate agent, but we do invest in some real estate companies, so I can kind of give you my view, and I think it really depends on what your time horizon is. So I think if you look at the long term, I think the two sort of most important factors for driving real estate prices are immigration and interest rates. And I think in the long run, you know, those two variables look pretty good. There's been a lot of protectionism south of the border, and that's good for immigration here. And, you know, the Bank of Canada is committed to keeping interest rates low for an extended period of time. So I think if you look out in the long run, those fundamentals are pretty good. But I think there can be some short-term hiccups. You know, one interesting statistic is that about 15% of residential mortgages in Canada are on deferral at the moment. So you have about 15% of Canadians not paying their mortgage. And those deferral programs really went into place in March for 6 months. So sometime in the fall, we're going to find out what fraction of that 15% will, not be able to continue paying their mortgage, and, who will go back to paying their mortgage like they were before. And so I think there's some concern around that, and we could see some hiccups there. And there could be some, opportunity in the real estate market then. So I think in the short run, you could see some volatility, but I think long run, the fundamentals are good. If you're buying a home and planning to stay there for a long time period, I think it's a good time.
That's great. I know last house calls we had an expert from the travel industry, and we're seeing travel opening up a bit nowadays. Dr. Tepper, do you still recommend sort of that quarantine stage when you come back from traveling, that sort of thing? We're seeing that as guidance. Is that something that you feel is helpful in kind of still reducing the curve, so to speak?
So I think we have to remember that, to the best of my understanding, the Federal Quarantine Emergency Measures Act, or the Quarantine Act, is still in place across the country, which means that when you come back from beyond the borders and you enter under the Quarantine Act, you're actually required to quarantine for 14 days, even if you go get tested or anything else. So we're actually still governed by a Federal Emergency Measures Act called the Quarantine Act. And so that governs us for any international travel. If you're traveling within the country, I still think it's advisable to self-isolate and quarantine. You could go get tested as well when you come back. You'll need to wait a couple days because there could be an incubation period. And then you could go get tested after being home for a couple days, continue to self-isolate until you get your results. But I do think it's important when you're traveling. There's a lot of high-touch areas as you move and travel, and you're in touch in often physically proximate areas. So I think we should be cautious.
That's great. Yeah, very important. A question for the front line, I guess, really, as it relates to the team at the hospital. How are you, keeping the front line motivated, engaged, and safe and healthy, both physically and mentally, given all that's going on and the support that they're providing to the community?
Yeah, I think that's something I think a lot about. We have a phenomenal front line here at this hospital in our long-term care, in fact, just right across Ontario. And, I just want to acknowledge all of them at the front line and thank everybody who's been so supportive of them in so many ways, big and small. They come to work, they remain motivated because this is their profession and this is what they believe in. And so the motivation is not necessarily a problem, but what we do need to do is keep them healthy, physically and mentally. And on the physical side, we really want to make sure they have the PPE, and our supply of PPE has improved. And it's still under stress, but it has certainly improved. And we want people to use it well. So we spend a lot of time making sure they have what they need that's appropriate for the situation, and that they know how to use it and are using it effectively. And then, of course, the mental health is important. And one thing I will say is I think we've had more open conversation about the need to talk about mental health than historically we have. And that's a great place to be, that we're having more open dialogue about mental health. And I think we're putting a lot more time and resources in, both for patients and into front lines, to provide for mental health services. We have a wide range of options available. We promote them to our frontline teams and also to our managers and our senior leaders as well, who are working hard and are under physical and emotional stress. So I think we're very attentive to it. We're very conscious about our efforts to address those issues. And then the other thing is we spend a lot of time just communicating. We talked at the beginning about how corrosive uncertainty is to our well-being. And so the more we communicate, the more we share, the more we're transparent about what's happening, the more we hope to help people's mental well-being. And so we spend a lot of time in open communication with our front line, listening and sharing.
That's great. Wonderful to hear. So Andrew, here's a question for you. With the benefit of hindsight, did we not overshoot the economy? And then part two is the massive hardship we created both financially and mentally justified?
Yeah, that's a tough question. Well, we as a society are trying to walk a tightrope between health, healthcare, and keeping the economy going and keeping people's personal financial situation in good health. And I think that's been a really tough rope to walk. I think that if you look back on the unemployment that was created in the early months of the shutdown in April and part of May, the unemployment rate got to over 20%. I mean, we're talking about a lot of people who lost their jobs. And thankfully, that number has come back down pretty substantially as the economy has reopened, but we're still operating at a very elevated unemployment rate. I think that the government has put in place a lot of programs to try to alleviate that hardship that the person who asked the question posed. The wage subsidy programs, the CERB, all of these things are an attempt to soften that hardship, but they also come at a cost. I mean, we are going to come out of this significantly more indebted. So, I mean, I don't have an easy answer. I do think the approach that we took in March and April was somewhat shotgun, just shut down everything. And I think that if we do have a second wave, hopefully we can find ways to keep things more open, or at least partially open.
That's great. Dr. Tepper, anything to add there, or yeah?
No, I mean, I think we're constantly learning more, right? This has been a huge learning curve for us. We're learning more about the virus, how it moves, how it's transmitted, and how we can keep each other safe. And so I think the more we can use things, particularly like masking, and structure our spaces in our work life and outside of our work life to maintain physical distancing, the more we can limit the impact of a second wave, and the less draconian the responses will have to be.
Yeah, no, that's great. So I know we're going to have the fortune of getting a mass demo from you a little bit later, but a question here is just, what about when we're outdoors? Maybe not necessarily going to the supermarket or anything. We're just really outside, out maybe for a walk in the park. Masks, no masks, and then also, do the masks need to have filters? Maybe you can talk a little bit about what's important as it relates to masks.
So there's a lot of different masks, and we have to remember we wear masks for two reasons. First of all, we wear masks to keep from transmitting the virus from ourselves to other people. And that's a really important part, especially because so many people who are sick have very mild symptoms. And so you may not really appreciate that you're sick with COVID-19. And so the mask is, even if you don't realize it, you're keeping others safe. It also will keep you safe from people sort of transmitting the virus to you, or from you by being close to you and breathing on you, and from touching surfaces and then touching your face and transmitting it that way. And so my bottom line is, it depends who I'm with. If I'm out alone, outside, then I don't. If I'm out with people who are in my tight bubble, like my immediate family, I don't. But if I'm going for a walk with a friend, even if we're walking outside, then we both wear masks. And so I do wear a mask when I'm outside with friends, if I can't keep 6 feet apart. And if we're walking side by side down a sidewalk, having a conversation, looking at each other, we're not 6 feet apart. And so I'm going to wear a mask for that walk. If we're going to all meet at a park and really be diligent about keeping 6 feet apart, then I may not wear a mask because we're maintaining that physical distance. So if you can, it depends a bit who I'm with, and it depends if we can maintain the physical distance while we're together outside.
That's great. That's very, very helpful. Andrew, what about, as we look towards emergence, do you have a perspective on certain industry sectors that you think will be solid growth opportunities?
Yeah, I think there's going to be a number of beneficiaries and winners that come out of this. An obvious one is e-commerce. We've already seen a very big uptick in e-commerce penetration. A second one is cloud computing. Work from home is very much enabled by cloud computing, so that would be a second one. A third one that I've invested in my fund is companies that are involved in supply chain change. So I think what you're going to see in the future is you're going to see retooling of supply chains, and you're probably going to see companies carrying more inventory. I think this whole pandemic has taught us that it's perhaps not the best business decision to run supply chains really lean with minimal amounts of inventory in the system, because you get a situation like this and it can be quite problematic. So we've invested in one company that does supply chain software. We've invested in another one that does warehousing and logistics real estate, because we think there's just going to be more demand for that type of real estate coming out of this. So those would be a few areas.
That's great. I know from my perspective, just being on the digital side, obviously on the retail banking, is that people not being out, being able to go to branches and what have you, we've really seen the notion of digital adoption, right? And so while it's always been there, when you don't have another option, right, we really see that. And so I would definitely say, organizations that even when they do have a digital footprint, there's been a lot of demand and really scaling that and ensuring that there's the capacity to support and service there as well. So thanks for that. Dr. Tepper, what about things like, obviously, people staying healthy in general, but do you have a thought around any types of supplements that would be things that people should be thinking about to ensure that their immune systems are up and supported?
I wish I could say go out and buy this herb or this vitamin and it'll protect you. Unfortunately, there isn't any evidence about that. And people have looked. It's not that people haven't considered this. There have been trials looking at vitamin C, vitamin D, other things, but there's been no evidence at all to support sort of supplementation in any way. So unfortunately, there isn't, is the bottom line. Continue to do the things that we do know about, which is getting lots of sleep, maintaining a healthy, balanced diet, minimizing alcohol, exercise, the things we chatted earlier, but there's no evidence base otherwise.
Great, thanks. So this is probably a question for all of us. It's just a bit of a perspective, and knowing that we don't have a crystal ball. But how do you think that our society, behavior, socializing, travel is really going to change, and how long, or do you, in fact, do you think we're just going to, go back, to the old way? What do you think are some of the things that are going to change, just given, what we've been through so far and what we're, the current state that we're in? Andrew, do you want to start with that?
Sure, yeah. Well, I think office culture may change fairly significantly. I think that, this is going to, open a lot of employers' eyes to the fact that, people working from home can actually do it fairly efficiently. So I think that, you may see changes in office real estate, you may see changes in, office culture. And I also think business travel may change because of this. A big part of what I do at Burgundy is we go out to visit companies. So we'll go to Montreal or Calgary or Vancouver, and we'll meet a dozen companies and try to find things to invest in. And, we've been doing all of that digitally, and it's worked quite well, actually. And so it sort of begs the question, do we need all of that business travel coming out of this?
That's great. What about you, Dr. Tepper? What about, care in general, those kinds of things? What do you think about that, or otherwise? Yeah.
I think there'll be a few things that fundamentally change. One is virtual. My family practice has moved predominantly virtual. Now it needs to go back more physical than it is, and I can't wait till it does, but it should not go back nearly to what it was. And so I think we're really going to see the entrenchment of virtual care, which is good. It's been overdue. Healthcare has lagged other sectors, other industries in adopting virtual. And so that's a big change. I really hope that we're going to continue to see a lot more focus on long-term care. That has been, one of our failings, certainly. And so we really need to think about how we support and invest in long-term care. And I would say public health as well. We need to really think about how we support public health on an ongoing way. And I think a big question, one of the things we've seen is just how interconnected our healthcare system is. I think we've always known it. We've talked about it. We've talked about integrating healthcare. But as I mentioned earlier, the work that the long-term care home that we've been doing as a hospital with long-term care is a bit unprecedented and shouldn't go back. The connections we're building with primary care, with home care, have really accelerated and should not go back. So I hope we see a system where there's fewer cracks and it's more seamless for people who are moving through it.
Yeah, that's great. I know from me, or at least specifically in my family life, there's been so many things that have changed. And I would say I was actually very much an early adopter with, grocery home delivery and, very loyal customer. I won't mention to who, but, and there were moments where I actually could not get a delivery slot, right? And so I was actually going the opposite. I actually had to go out to the grocery store because my usual way had sort of overtaken capacity. But also the education system, right? And so I've got, high school boys that, have had to radically shift from a very, in-person and also very social environment to being quite isolated and online. And I think, one of the things that we learned that particularly for certain personalities, let's just put it that way, it is hard to do what I'll call self-learning, right? And it's hard to do even a half a day of school on Zoom or, on a video conference. But even harder for, younger kids. But then on the social side, I've seen them also adapt, right? Where they're accustomed to, FaceTime or using video just to call each other, but they actually are socializing that way when they've been in isolation. And so it'll be interesting to see where our education system also goes. What are the things that we are going to do still through e-commerce versus in person? And I think there's still, I think, from a consumer perspective, a lot of unknowns still out there. So it's going to be very interesting to see, what percentage goes back or what percentage it goes back to our old habits and what still stays adopted to the new ways that they've adopted over the last number of months. So it's quite interesting. So sorry, just I've got some questions maybe here for Andrew. This is from a senior in her late 70s, and she's worried about her savings, in particular how to manage the RIF and the TFSA accounts. And wondering if she should sell everything, but they're currently being advised to really hold on. Do you have any, obviously not having the total personal perspective there, but do you have any thoughts on whether people should sit tight and hold on or be making dramatic shifts, I guess?
Yeah, I mean, very hard to say without knowing the full kind of picture of what the portfolio looks like and what your personal living situation looks like. I sit on our investment side, so really most of what I do is researching companies. But I can kind of tell you what my colleagues on the investment counseling side often tell people who are in that situation. So our usual rule of thumb is you want to hold 2 years worth of living expenses in cash. And if you do that, you're in a situation where you're not a forced seller in a down market. You really don't want to be in a situation where you've got to draw down on your investments in March, for example, and the stock market's down significantly and you don't have enough cash on the sidelines to fund your expenses. And then as an additional precaution, what we often tell people is to hold 3 to 5 years worth of expenses in high grade bonds. So either government bonds or high investment grade corporate bonds. And again, those are not cash, but they are closer to cash and have low volatility. And so if you sort of do that, if you have 2 years of cash and an additional 3 to 5 years in high grade bonds, you're pretty well protected for a whole stock market cycle. And then you can kind of comfortably hold the rest of your portfolio in equities and never be in a situation where you've got to be selling them in a down market.
That's great. That's some great advice.
Very good advice.
Yeah. Dr. Tepper, again, I'm shifting because the questions are sort of bouncing around, but I want to make sure we have a chance to address a variety of topics. What about contact tracing, right? I think, we hear different areas around the world are sort of tackling it differently, but specific to the GTA, is it currently being undertaken in Toronto, the Greater Toronto area? Maybe you could offer some insights there.
So first of all, what is contact tracing?
Yeah, I think that's a great.
Not know the term. So contact tracing is when you find somebody who has been sick, diagnosed with in this case, COVID. And then you find out who they've come in contact with, and you go to find those people and you test them. And again, if they're positive, who have they been in touch with? And you sort of roll it out. And it's not a new concept. We've been doing this with syphilis and chlamydia and HIV and other infectious diseases, SARS, forever. And we have been doing it since the beginning of COVID. What we're trying to do now is to do it more effectively. Look at moving it to more digital platforms, look at using technology to help with contact tracing, while also balancing the very legitimate privacy interests. And so contact tracing has been happening. The amount of disease we've had has made it hard to do as well as we'd like, but there's been a major investment. More investments have been made recently, and we're really trying to figure out about the role of technology as well. Testing is one thing, but remember, you're testing one individual and maybe quarantining one individual. What about everybody else that person came in contact with? And that's the real value of testing, is the additional contact tracing. So it's a critical part of our response. We've been doing it in the GTA, and we need to be doing more of it and increasing our ability to do more of it.
That's great. And then on the note, if is it true that once you've had the virus, then you become immune?
That's a great question, and I'm not sure we know yet. I don't think we know for sure. We do know that we create antibodies, which should protect us, but we don't know how long those antibodies will last. We do know that people will say, oh, I've gotten strep throat more than once. I've gotten a cold more than once. We know that we get diseases more than once. And either because we didn't get enough of an antibody or immunity response, or because the virus changes in some way that the antibodies we develop don't protect us. So I don't think we know enough yet. There seems to be some evidence that at least for the short term we're protected, but we don't know enough about the medium or the long term. And it will depend a little bit on how the virus changes as well. So it's a really important question that we're going to watch very closely.
Right. And another one, Dr. Tepper, is what would you suggest for someone who feels that their mental health is at risk?
Yeah, it's a really good question, and I thank whoever took the time to write that. As I mentioned before, too often we don't talk about mental health. What I would say is please get help. Please get help. There is a lot of help available. I know the healthcare system does not feel as readily accessible, but actually psychiatrists, counselors, psychologists, family doctors, emergency rooms, they're all finding ways to see patients. And so if you're having any mental health issues, please don't hesitate to reach out and get professional support from people. It's so important, and it's so understandable with everything that's happening that people will be having mental health illnesses for the first time, or people who've had problems in the past will have it come back or get worse. And so it's totally understandable, and help is out there.
That's great. And I know, whether through companies or just, as we were talking about a little bit before, that online availability to support and services is available. So I think it's a place to be able to go as well, to be able to look to see what type of abilities are online as an opportunity for folks as well. So
I agree, but go to credible sources. Go to sources that the Ministry of Health or Health Canada are promoting and supporting, or that your local family doctor or your hospital is supporting. Not everything online is actually what it appears. And so there are great online resources and programs, but make sure you're finding them through very credible sources.
That's a really great point. So Andrew, back to you. Some questions about Canadian small caps of any significance all seem to be listing on NASDAQ now. Is that a trend that you think is going to continue?
Yeah, that's a very specific question. I think what you often see is certain sectors choose to dual list on the Toronto Stock Exchange and the NASDAQ. It tends to be companies that are in technology or in biotech. And I think there's a couple of reasons for that, but just one of them is that the American investment audience is more accustomed to investing in technology and biotech. those industries are just a lot smaller in Canada, so you have less investor experience investing in those places. You know, I think the second reason is that the American stock market is a lot deeper than the Canadian stock market. It's more liquid, and so there can be benefits to listing on both exchanges. And yeah, I think you do see that, but it tends to be in those sectors. Other sort of, you know, consumers companies, industrial companies, they tend to, you know, stick more to just listing on the TSX.
That's great. And I think this is probably one of our last questions before we move to your demonstration, Dr. Tepper. I'll give it to Andrew. What are some more innovative ideas to consider when managing costs during the unprecedented times? So perhaps with respect to employee benefits or things along those lines.
Yeah, it's been very interesting to see how different companies are handling costs through this time period. It's been fascinating. You know, I probably talked to 3 or 4 dozen companies since this started. And, you know, I think each of them takes a different item on their income statement and tries to find cost savings. So, you know, if you kind of work down the income statement, you know, one of them would be cost of goods sold, your input costs. And I see a lot of companies going to their suppliers and saying, you got to help us. You got to give us 10% off. You got to give us 20% off. Particularly in very hard-hit industries, you see that a lot. Companies are asking their suppliers to share the pain. You know, on the employee side, the employee benefits thing is quite interesting. I mean, you've seen a lot of companies furlough employees. Many of them have kept employees on and used the wage subsidy program, so they're only paying a portion of the person's salary. Employee benefits, interestingly, so far, most companies haven't touched. There's actually 2 employee benefit companies publicly traded in the small cap market. And I've actually talked to one of them recently, and they said they really haven't seen much benefit cutting. You know, I think part of the reason for that is, you know, very few employers want to be the person to cut, you know, drug benefit plans in the middle of a healthcare crisis. So we actually haven't seen that much of that. And then I guess the last one would be rent and interest expense. And there, I think you have seen a lot of companies try to defer. You know, I think landlords, at least some of the ones that I've spoken to, they have been accommodative to small businesses, waiving rent for a couple of months. You have to end up paying it, but you pay it later. And likewise, banks with business loans offering deferrals. So I think there's lots of items you can use to try to get costs down temporarily. And I think every company is using some to a certain extent.
That's great. Super. So, Dr. Tepper, can I pass it to you to give us a demonstration of how to put a mask on?
Sure, absolutely. And let me just start by saying that the reason we're doing this and talking about masks is that the body of evidence just grows and grows about how important and how helpful masking is outside of healthcare settings, so in the general public. And this isn't just in Canada. There are studies now coming out from around the world about how effective masks are in reducing the spread and allowing us to reopen the economy and our personal and professional lives more effectively. So it really is an evidence-based approach to responding to the pandemic. The other thing I'll just mention quickly is a lot of people say, well, you know, I'm not a high-risk group or I'm not likely to get sick. A lot of what you're trying to do is keep other people from getting sick. So even if you don't care about getting sick, you should care about making other people sick, and particularly people who you may not appreciate you're exposing and putting at risk. So really, really important. So here we go. First of all, wash your hands. In this case, I've got some hand sanitizer. So we're going to do, I'm not going to sing happy birthday. I'm a bad singer. But do a good hand hygiene.
Maybe I can get Andrew to sing while you're...
We should have divvied this up. So again, remember palms, both hands, fingertips, front and back, and do a really nice, thorough job. Then you can take your mask, reusable or disposable. I've got a nice reusable mask. Pick it up by both ends so that I'm not touching the outside part or the inside part. I'm picking it up by the loops, and I'm placing it over my nose and my mouth, and then straight behind the ears. And so then it's in place, and it should fit comfortably, snugly, so it shouldn't be baggy and loose, but it shouldn't be so tight that you're having a hard time breathing or it's causing a headache or really pulling behind your ears. If you're not used to using a mask every day, it can absolutely take some getting used to. And the first few minutes after you put it on can feel very disquieting and a little bit claustrophobic. Let your body get used to it. Don't climb a flight of stairs, move slowly, don't do things to increase your oxygen demand, and just let your body get used to it. The most important part now is what to do once you're wearing a mask. And, there's so many ways of sort of compromising the safety that a mask gives you. So once it's in place, you want to leave it on. I see people pulling it down underneath their chin, lifting it up. All of those things, first of all, you're coming in contact with the outside, which is potentially dirty, and then you're going to be projecting and compromising its safety. I see people reaching underneath to scratch, and of course, whatever's on your hands now is now right underneath your mask, and you've compromised the mask. I see people taking their cell phones and sliding it up underneath. Your cell phone isn't necessarily clean, and the hand that's holding it isn't clean. So again, it stays on the outside of your face. I see a lot of people doing the one loop. Again, the phone rings, they loop it off. And again, you're reaching your hand across your face to unloop it. And of course, now you're once again exposing yourself, you're touching your face, and you have this mask that could be dirty on the outside, sort of dangling and sort of putting the particles right up in your face again. So once it's in place, it needs to stay in place. Don't touch it, don't fiddle it. And if you need to adjust it, again, try to clean your hands first, and then really try to adjust it a bit from the back if you need, or clean your hands and then adjust it and clean your hands again. When you're ready to remove the mask, again, clean your hands. I won't do it, I've just done it. And this is a clean mask, never used before, so, but clean your hands thoroughly. And then again, reach behind the loops, tilt your head down, and lift it off, and put it then, and then put it to the side, and clean your hands again. And then if you need to do something, repeat the process. If you're done with the mask for the day, remember the outside is the potentially dirty part. And so you want to fold it in a way that the outside will not be exposed. And don't put it in your pocket, because then you're going to contaminate your pocket and reach in and touch it and play with it and then forget and touch your face. So you fold it, put it away into a bag, and then it can be washed later. And probably wash it at the end of every day, is sort of a reasonable approach to make. And you can just wash it with normal hot water and normal detergent that you'd use for washing any fabric. So again, lots of evidence and difficult to get into the habit, modestly difficult, but really effective. And once you get used to it, it does become much easier to do, and you almost forget you're wearing it.
That's great. That's very helpful. Really helpful tips. And
so somebody asked about glasses. Sorry, Nicole. It's a great question. Lots of people wear glasses. I'll take 30 seconds.
Yeah.
So one is the better fitting it is, especially at the top, without being tight but snug, the less risk. You can buy anti-fogging for your glasses. And also, if you put the glasses a bit more down and over the top of the mask so it holds it tighter, it's less of a risk as well. So it is trickier for people who wear glasses, but there are lots of little tricks and solutions that you can do. So not a reason not to wear a mask.
Fantastic. Very, very helpful. Thank you, Dr. Tepper. So I think we're going to wrap things up. Before I hand it to Dr. Tepper, Andrew, are there any last words that you wanted just to share with us this evening? And then we'll pass back to Dr. Tepper.
Sure, yeah. I mean, I guess one last thing that I would say, and it's investment advice that actually the founder of my firm gave me through this crisis, is that investment time horizons tend to shorten. People's time horizons tend to shorten during a crisis. We start thinking about next week, next month, and it's important to remember to think long-term when you're investing, and that we will get past this virus. I mean, it will go away, and there is another side to this economy and market. So that's just the last thing I would say.
That's great. Thanks, Andrew. And Dr. Tepper, may I pass it to you for our final words of thought and wisdom, and just to kind of close out this wonderful conversation this evening.
Sure. Well, I'm going to close, first of all, by thanking Andrew as my co-panelist and you, Nicole. for doing such a great and effective job hosting tonight. Thank you both and for your contributions to the foundation and the hospital. My thanks to North York General Foundation for hosting this excellent event. And I just want to thank everybody who's dialed in tonight. First of all, for the broad support you've given our frontline healthcare workers. Thank you for the excellent work you're doing about physically distancing and keeping yourselves and others safe that are allowing us now to be in phase 2. And actually, thank you for taking the time to come in tonight and to learn a little bit. You know, there's a lot of misinformation out there, and we're trying to provide people with sort of fact-based, evidence-based, science-based knowledge from both my sector and the finance sector, so that we have less uncertainty and we have more knowledge to deal with this very difficult time. So thanks for making the time, and thanks for, again, supporting North York General and our healthcare system, and especially our frontline. Have a good night, keep safe, keep well.